This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Eduardo Bruera, Department Chair in the Department of Palliative Care and Rehabilitation Medicine in the Division of Cancer Medicine at the University of Texas MD Anderson Cancer Center in Houston. Hello, Dr. Bruera.
Hi.
If you would give us some history, some background into the evolution of palliative care.
Palliative care started really as what is called the UK hospice movement in the 60s. And Cicely Saunders, who was kind of a revolutionary person, basically took care of patients who were not receiving very good care by organized medicine. So we are really a movement of the 60s. We should be seen as a fringe movement that did not start in the big universities, it did not start in the organized hospitals, and it started as a kind of revolutionary movement. So this fringe movement was progressively adopted, and it crossed the ocean to Montreal, where Dr. Balmount basically created the word palliative care, when hospice care that took place in basically self-standing houses or at home was for the first time practiced in teaching hospitals. And Balmount created this word palliative care.
About what year was that?
His first opening of a palliative care unit was in 1976 in Montreal, so quite a few years ago. If you think about it, very mainstream specialties like emergency medicine or critical care medicine that were created by mainstream medicine were born later than palliative care, but those were born within organized medicine. And you couldn't even imagine today an acute care hospital not having an emergency center or an ICU. But still today in America, most acute care hospitals do not have a palliative care unit. And a small number of American hospitals have an outpatient center for palliative care. So it's taken longer for palliative care to be adopted because it was not born out of organized medicine and academic medicine. It was almost by popular demand that it became progressively adopted, and is now become kind of more widely adopted.
Since palliative care specialists they can come from many different disciplines. What is the education if one's already, let's say, a board certified in Doctor of Internal Medicine? What does he or she have to do to become a palliative care specialist?
They have to take a one-year fellowship in an accredited institution. For example, Anderson has 5 slots every year to train for 1 year one of those specialists into this subspecialty, and after that they have to take a board exam and they become subspecialists in palliative medicine.
And in medical school education, is palliative care being integrated into the curriculum?
At a very variable and generally slow speed. For example, not only in medical schools, in postgraduate education, we have a 1-month mandatory fellowship training for medical oncologists at MD Anderson, but none of our competitors have that at this point. And it's a big problem because when those med-oncs spend 1 month with us, they become the most rabid advocates of using palliative and supportive care. So I would like to take this opportunity to invite the program fellowship program directors to take advantage, because it's scored by our med-onc trainees as one of the highest rotations in their training experience. So you're going to make your med-onc fellows happier, and you're really going to make a great service to the development of the specialty if you make this 1-month mandatory rotation present. In fact, ASCO strongly recommends that this be done, but some of the biggies don't even still have a 1-month mandatory rotation in palliative care.
I'm very grateful that you took time out to spend with us today in the group room. Dr. Eduardo Bruera, Department Chair, Department of Palliative Care and Rehabilitation Medicine in the Division of Cancer Medicine at the University of Texas MD Anderson Cancer Center in Houston. Thank you so very much.
Thank you. Thank you for having me here.